Senator Comerford.
Thank you, Madam Chair. Secretary, thank you so much for your remarks and for all of your work and that of your team. There's so much that I was grateful to hear about. Maternal health, of course. I was privileged to be able to be part of that racial inequities and maternal health task force with many in the Senate. And the work that your agency is doing is really exemplary. HIP, of course, you saw me smile. The ABLE accounts, which I think is significantly good news, talking about DCF and foster parents and really understanding the struggle there. I was a foster mom, my wife and I, 2 times, and it's the best thing I've ever done. And we have 2 beautiful children. CNAs, and here I would just say I really applaud DPH in doing the work of language access and fees. I hope we can go further and really look at the test and make the test more accessible. Commissioner Goldstein and his team have been wonderful. Medicaid estate recovery, Mass Health folks have been extraordinary. I really hope I have a bill with Rep. Barber to take us back to the federal minimum. I think we can do it in Massachusetts and be a leader in rolling back what I think is a pretty draconian pursuit of estate recovery. But I wanted to ask about the budget in relation to so much good. I want to frame this in so much good. And
there's a but coming.
Oh, no, it's not. It's actually a question about the budget's relationship to PCAs. I have a constituent who passed recently. His name was Joe Tringali. He was for me, one of the brightest stars I've ever known. He lived his life as a disability rights advocate and had taught me so many things. And so he taught me the value of PCAs for his life. He wanted self-determination in his own life, and he wanted to be able to access what he wanted to access on his own terms, and autonomy for him was significantly important. And I have loved the PCAs with whom I've met, and I'm wondering about the cuts that I understand are in the budget to the PCA program. And I have many constituents who access services from PCAs, and they are the better for it. And I'm wondering what your thoughts are there. And again, this is in a larger context of so much good, but I do have concerns there, and I just wonder how the department is factoring this in.
Thank you. Thanks for the gentle wind up to the hard pitch. I don't
want you to think of it as a hard
considering the baseball metaphors, but I really appreciate the question because it gives me a chance to help you guys understand how I'm thinking about it.
I would love that.
We have probably the most generous self-directed PCA program in the country. And with the recent contract negotiations, created a career pathway with dignity and thrivability for the people who choose to do this incredibly important work. It's on track to be over $2 billion a year by 2027, which is per capita more than any other state. And we were looking at the rate of growth and trying to find the most effective and humane way to manage that. And it was really focused on making sure that the people who need this program the most can maintain their independence and resilience. So unlike other states with very generous benefits, like California, we chose not to cap the number of hours somebody needs. If somebody needs 80 hours in a week to stay in their home and live their life and do their work, we will pay for that. Instead, we chose to look at the parts of the program that were unnecessarily legislatively prescriptive. How much time meal prep takes, for example. And that was cut because we figure if people are in the home, meal prep is part of the work. And the other was to look at those members who use less than an hour a week and to say there's probably a better way to support that patient population. Now, it's 8,000 people. And for those people, that's a big wrench. I think it's 8,000 to be sure, but it's about that number. But the thought was that if you only need 1 hour a week of services, there's a better way to get those services than this PCA program. Because remember, we have a significant shortage personal care attendants across the state. And we wanted to make sure that people who were able and skilled and expert enough to do this work were available to people who need it.
Thank you so much for that, really, for that context. I love spouses as caregivers, which is something I hope we move to at some point. But do you have a sense of what if I may, Madam Chair, just ask a follow-up, do you have a sense of what alternative you're proposing for these good folks who are receiving meal prep services now?
Right. So, well, they'll still get meal prep if they're PCAs in the home. That won't change.
But if it's the 1 hour a week, as you say,
it's 1 hour a day.
Sorry, I meant day. Thank you.
The alternatives will be
10 hours.
10. Sorry.
Sorry. No, sorry, please. No comments from the.
If I'm wrong, I'll correct. Mike's up next, so he'll
Okay.
correct it. But the alternatives are home health aides or homemaker services for people who are in the less than 10 hours category. Group adult foster care, daycare, adult daycare or day health programs. There are other alternatives which also have the benefit people have.
And for the first two, that would be covered under.
Yes.
Okay. Thank you so much. Thanks, Matt.